16,074. This is the current total number of deaths in the United States due to the dreadful disease known as the coronavirus, according to CNN. This number continues to rise as we speak. In fact, an average of about 116 New Jerseyans die every single day, and just yesterday, 275 more passed away. This disease has now killed more New Yorkers and New Jerseyans than the 9/11 attacks. This type of coronavirus is so new and has never been seen in humans before, so nobody has really developed antibodies to protect themselves from it. Limiting contact with other people and staying home is the best way to prevent COVID-19, which is why it is extremely important to have everyone's cooperation. This is relevant to us all because this global emergency continues taking the lives of thousands of people each day, and it is essential that we all do our part to help prevent this horrible pandemic. As a health science major, I have taken courses in which I have studied the biology of diseases, how they are spread, and how they may be stopped. Social distancing and staying home are the best ways to flatten the curve and to end the coronavirus faster. Today, I will be talking to you guys about why you must stay home and practice social distancing, wash your hands often and correctly, and why you must wear gloves and a face mask if you really need to leave the house. Stay home and maintain social distancing. Since there is no current vaccine to cure COVID-19, the most effective way to prevent it is to avoid exposure by simply staying home. According to Dr. Schaffner, an infectious disease expert from Vanderbilt University, the 6 feet distance rule comes from studies of respiratory physiology. So you may ask, why exactly do you need to stay 6 feet away from people? Well, 3 to 6 feet is considered a breathing zone in which you may inhale what the other person is exhaling. If this person is potentially infected with the virus, you would inhale their germs and become infected as well. Many people continue to crowd beaches or linger in public places in groups, and at this rate, the coronavirus will continue spreading if we downplay the situation and don't take it seriously. At the moment, our healthcare systems are unfortunately stretched beyond capacity, and the efforts we are doing now are proven to help flatten the curve and slowing down the number of new cases so that everyone who is sick can get the care that they need. This leads me to my second point, which is that you must wash your hands as frequently as possible, especially before you eat or come back home after going outside. You cannot always control what you touch or who touched it. The virus can stay on your hands and enter the body when touching your face. This is why the best way to wash is with soap. According to WebMD, COVID-19 is encased in a layer of fat. Soap has chemicals that can break the fat apart and make the virus unable to infect you. Soap also makes skin slippery so that with enough rubbing, we can rinse germs off. In order to properly scrub your palms, in between your fingers and the back of your hand, plus rinse, it is crucial that you wash for at least 20 seconds. It is also incredibly important to wear gloves and masks if you really need to leave your house. The coronavirus can easily spread from person-to-person contact through small, tiny particles when a person coughs, sneezes, or even when they talk. These droplets can land in your mouth or your nose and are then inhaled into your lungs. According to the CDC, many people may also be asymptomatic, which means that they do not show any symptoms and can simply be carriers of this disease. They can infect you without even knowing it, which is another great reason why everybody must effectively do their part and stay home. There is a great shortage of face masks at many stores, and these should be saved for healthcare professionals. If you find yourself with no face masks available, there are many ways that you can make a homemade one using a bandana or a scarf. We once assumed that this illness would only affect older people, but according to the CDC, young, healthy people are suddenly becoming critically ill. Among the first reported cases in the US, around 40% of the patients that required hospitalization were between the ages of 20 and 54. COVID-19 unfortunately does not discriminate. It does not care about your gender, race, or economic status. And there's no guarantee that you will not become infected unless you stay home. During this global emergency, it is extremely important that we take the necessary precautions to stop this vicious virus from taking any more lives. The world has changed drastically in a matter of weeks, but the faster we are able to take these precautions, the faster everything will be able to go back to normal. If this is not done, this pandemic may last for months on end, and the life we once knew would just be a faint and distant memory. In order to allow this tragedy to end, I ask all of you to please stay home, stay safe, and stay healthy. Use this time as a break from the world and continue to practice social distancing so that you are able to hug your family members and your friends again soon. Our healthcare workers continue to risk their lives each day as we fight this virus. They stayed at work for us. The least we can do is stay home for them. In the words of our Governor, Phil Murphy, have faith. We will beat this if we all work